Let's talk about how to make a bottle of formula. My name is Ruth, I'm a health visitor in England. Let's get into it. First things first, these are sterilised. If there's been used in sterilising fluid, then we're going to flick that out into the sink. It's okay if there's a little bit in there, it doesn't have to be bone dry, but we want to make sure there's not as much in there. 1 litre of fresh water from the tap or from one of these, fresh, boiled, and we don't want to leave it in here for longer than 30 minutes. Ideally, we want the temperature of the water to be at least 70 degrees, because 70 degrees and beyond is what's going to kill any harmful bacteria that is in the formula powder. And that is really important, because if there is any bacteria in the formula that hasn't been killed by the boiling water, then it can cause diarrhea, vomiting, food poisoning, etc., etc. Next, we add water to the bottle before we add the formula powder. This is going to ensure that we've not used too little or too much water. Too little can cause constipation, too much can be dangerous for babies. We're going to double check the water line. Yeah, it's at the right place. And we're then going to add our formula. I haven't got a formula scoop, so I'm just going to use this little one. We're then going to level that formula off. As per the manufacturer's guidelines of how much you're adding, we're then going to add it into the bottle. Cover the teat with the cap. I haven't got one, so let's just pretend. And then we're going to gently, we're not going to be doing this. Oh, we're going to gently dissolve the formula into the milk, into the water, you know what I mean? If it is too hot, we can then run it under a cold tap or put it into a bottle of cold water with the lid on to prevent any cross-contamination of non-boiled, sterilised water and cool boiled water. Obviously, we are then going to be checking the temperature of the formula on our hand. We want it to be body temperature, really. There's a few do's and don'ts. You must not use bottled water to make up bottles of formula. If you are going abroad, I recommend taking ready-made formula. I know it is more expensive, but we cannot be giving babies bottled water. The sodium levels, which is salt, are too high. Also, the bottle should be used within 2 hours if being kept at room temperature. So when they start feeding from it, you've got 2 hours to use that bottle up. If your baby has oral thrush or is suffering with oral thrush, you may want to be re-sterilising and starting a fresh bottle much sooner than that, because all you're going to do is, if they have this again half an hour later, is going to be recontaminating. Never ever warm the milk up or bottles of formula up in the microwave. There are hot spots in there, so some spots can be absolutely scorching, others not hot enough to kill the bacteria, and it can be a dangerous concoction. This should go without saying, please never ever ever add baby rice, rusks, baby cereals into formula. It is a choking hazard. It is recommended to make bottles up as you need them, one at a time. Obviously, if you're heading out, there are other instructions regarding that. If you'd like me to do a video on that, then please do comment below. How to make a bottle of formula if you are going out and about for the day. My name's Ruth, I'm a health visitor in England. Let's get into it. First things first, don't shoot the messenger. This is the NHS guidelines, and this is the guidelines to help prevent illness, to help prevent bacteria building up in formula. Let's get into it. Now, this is the first ideal way to take formula out and about with you. You're going to need 3 things. 1, a clean sterilised pot, which is holding your correct amount of formula in it. 2, a vacuum flask. Now, I haven't got one to show you, which I thought I did have. This is basically one of those insulated flasks where you can add boiling water to it and it keeps it at its temperature for a good amount of time. And 3, a bottle for your formula with the cap and the ring and all of it still in place. Now, the vacuum flask doesn't have to be sterilised because the boiling water will kill anything in there. Obviously, it does need to be clean, but you can clean this with water and washing up liquid. Now, we want to then use freshly boiled kettle of water. The temperature needs to be at least 70 degrees. And then we want it in that flask immediately, keeping nice and hot. I would do that just before you're about to go out. You can then, as and when, make a bottle of formula like you would at home, as if you had the kettle there with you. Now, if this isn't an option, the second best option is ready-made formula, which I appreciate is expensive. If no other option, the recommendation of the NHS is that you make a bottle of formula as you would at home. You cool it down under the tap, with the cap on and everything to prevent any cross-contamination. And then it goes in the fridge, and it must be kept in the fridge long enough for it to be cold when you take it out. Now, when you take it out of the fridge and it's nice and cold now, it can go in a cool bag with ice, and then that bottle of formula needs to be used within 4 hours time. If you don't have a cool bag with ice, it needs to be used within 2 hours. If you are keeping it in the fridge, say you've come to a friend's house, those bottles of formula need to be used within 24 hours from the moment they were made up until 24 hours later. So if kept in the fridge, use within 24 hours. If out of the fridge with an ice bag and a cool bag, use within 4 hours. And if out of the fridge at room temperature, not in a cool bag with ice, 2 hours. Even if in a cool bag without ice, it's still 2 hours because it's not being kept necessarily cold enough. I know there's going to be people saying, when my babies were young, I made up my bottles of formula and kept them in the fridge. This is called survivor bias. Just because something didn't happen to you doesn't mean it's not going to happen to somebody else. Now, I'm not talking about horrific, terrifying things here, but bacteria then has a chance to grow, which can then lead to how to get a breastfed baby to take a bottle. I'm going to give you all my hints and tips. I cannot promise you anything. Some babies are stubborn bubbers. You can try all these different things. My name's Ruth, I'm a health visitor in England. Let's get into it. First things first, I would be recommending letting them play with the bottle. No pressure here, there's nothing in the bottle. They're gonna play with it, so it's a familiar object. It's, you know, let them play with it like a toy initially. So when you do start offering it with milk in, it's not this, whoa, what is this? It's, oh, I've seen this before, I've played with this before. They don't have the comprehension, but you know what I mean? They've seen it, it's not an unfamiliar object. Another hint and tip is to actually let them play with the teat on its own. Obviously, the smaller they are, the more of a choking hazard, you being there with them. But familiarising themselves with it, chewing on it, letting it brush along their gums. Hopefully, eventually, they maybe learn to suck from it. But again, it's not an unfamiliar feeling in their mouth. Do not try offering when they're overtired or really, really hungry. They're just gonna get annoyed and it just may not work. Yes, some babies, they might, as a desperate last resort if they're absolutely starving, but what you might just see here is they whip themselves up into a frenzy, and we don't really want this to be associated with the bottle. So a good time to try is maybe when they've first woken up from a nap, they're rousing, they, you know, obviously when they're laying in the crib, don't just suddenly push it in, but they're rousing, they're, you know, waking, they're a little bit tired, they're a little bit sleepy. That's the time that maybe you can offer it and just let them try sucking from it, having done a bit of that previous exposure. Try lots of different positions, sat upright, with the television on maybe. We're not trying to necessarily mimic breastfeeding just yet. If they get the bottle, then we can start talking about paced bottle feeding and mimicking breastfeeding. Right now, we're just trying to expose them to it. So lots and lots of different positions. Try to let them latch from the bottle themselves. We're not trying to push the bottle into their mouth. Again, they're not going to like that. Let them draw it into the mouth themselves. You know, you can rub it on their lips. And this is where hopefully the exposure beforehand, it's not an unfamiliar object, but we don't want to be pushing it in their mouth. They're just going to get frustrated. Making sure that the person giving the bottle isn't the breastfeeding parent, because they're going to smell it on you. Why would they take something different from you when they can literally take it from your breast? They don't understand what you're trying to do. So making sure you're nowhere to be seen, preferably out the house if possible, and giving them something that smells of you, maybe a t-shirt that they can hold and smell of you whilst or you're holding it around their face whilst they're trying to feed. Not like here, but you know what I mean. Trying different temperatures of the milk. Some babies actually prefer cold milk in bottles. Some babies prefer warmer milk in bottles. Distracting whilst offering, whether that's television on, whether that's like a puppet show, or, you know, another child that you can pull in to help, an older sibling, different people trying to give the bottle, not the breastfeeding parent. If completely refusing the bottle, try different cups, different sippy cups. It may be they just go to taking formula not in a bottle. From 4 months, you can even give it via syringe if that's a way you want to give it and get it into them if you're going to be away from your baby, or from a spoon. Ultimately, it is expose, 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 practice, 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 practice. Any other hints and tips, please put them in the comments. Are you bottle feeding your baby? My name's Ruth, I'm a health visitor in England. Let's discuss paced bottle feeding. This is gonna help with gas, reflux, it's gonna help with getting wind out. It is the best way to feed a baby where they are in control of how much milk they take, and it's going to help with overfeeding as well. Okay, so we predominantly tend to think of babies laying down, feeding them like this. This actually, the milk is just pouring into their mouth effectively. They don't have to work particularly hard with bottles to get the milk out. They don't have to suck. This is no judgment here. We want to be mimicking breastfeeding as much as possible because that is how the baby is designed to biologically feed. So what we want to do is we want baby to be upright a little bit more, preferably again looking at us, mimicking breastfeeding. They're sat upright a little bit more, okay? We are going to be responding to hunger cues here. I've done another video on responsive feeding, so go take a look at that. We're going to be responding to hunger cues. We want to brush the teat along their mouth or lips and let them draw it into their mouth themselves. Have that nice wide open mouth. We don't want to be shoving it in. Okay, we want them to draw it in themselves, and then when it's in, we want the bottle to be more horizontal, not like this where it's like pouring out. We want it to be like this, where they're drawing the milk out themselves, they're working a little bit harder, a bit more actively taking that milk in. And then we're really going to be watching for cues that baby is full. You know, maybe pushing the bottle out with their tongue, turning their head a little bit, and we're going to come out. We're going to bring the bottle out. We're going to have lots of breaks. Again, this is going to help with reflux. Put lots and lots of breaks, letting them draw the bottle back into their mouth again. Don't worry about air being in the teat. It's now the evidence is showing that feeding them like this is what causes far more gas than them drawing the milk out themselves. This is the best way to feed them, you know, horizontally, baby upright a little bit more and looking at each other and really responding to those cues when they're full. If you have any other questions, please let me know. Your baby's on first stage formula, they're heading up to 6 months. Do we need to make the switch onto other stages? My name's Ruth, I'm health visitor in England. Let's discuss. It is recommended by the NHS to stick to first stage formula until a year old, if you are formula feeding, of course. Now, the other formulas are an advertisement ploy. Basically, all first stage formulas have to follow the exact same standards in England. None of them are better than the other. That's why we are not allowed to recommend any brand of formula, because all first stage formulas have to follow the exact same guidelines and are pretty much the same. So second stage formulas, toddler formulas, etc., 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 that is a kind of loophole in the system. They're allowed to advertise those, so therefore they've brought them out. And yes, they can be cheaper, but it's because they're purely an advertising opportunity for the brand. We recommend sticking with first stage formula until they are 1 year old. Obviously, it's completely up to you, and I appreciate it's a really expensive time at the moment, and I know a lot of parents have reached out to me and said, is it okay because I can't afford the first stage, which is just devastating that it's just so expensive. You do you, it's not going to cause any damage going on to second stage formula. We just recommend sticking with first. It's, you know, the most regulated and all sticks to the same guidelines and meets everything they need for the first 12 months of life. Does your baby need hungrier baby formula or second stage or third stage formula? My name's Ruth, I'm a health visitor in England. Let's get into it. First things first, guys, you do not need to move on from first stage formula ever. You can stick to first stage formula until your little one is 1 year old if you are exclusively formula feeding. If you're breastfeeding and you want to go on to formula, you can just go straight onto first stage formula until they're 1 year old. And then when they're 1, they go on to cow's milk, and they only need either 350 mils worth of cow's milk or 2 sources of calcium if you are stopping feeding. Follow-on formulas are purely a money-making tactic in this country, so it's illegal to advertise first stage formulas because they all have to abide by the exact same standards, so therefore none of them can be seen to be better than the others. So the follow-on formulas have been created as a loophole where then the formula companies can now advertise second, third, toddler stage formulas. They're not needed. We don't recommend them. We purely recommend first stage formula or going on to cow's milk at 1 year old or breastfeeding, of course. A hungrier baby formula is also not particularly recommended. It's much higher in casein, which is much harder for babies to break down. The theory is that the higher levels of casein are much harder and take longer to digest, therefore the theory is they stay less hungry, or full for longer, should I say. UNICEF state that the evidence shows that this isn't really the case. Because they're harder to digest, they can cause stomachache, they can cause more wind, they can cause constipation. They can just cause them to not be particularly happy because they're in a bit more discomfort in their stomach. So we don't really recommend hungrier baby formulas, particularly with the younger babies. There is no evidence that hungrier baby formula is going to make your baby sleep for longer. There is also no evidence or rhyme or reason for babies who feed longer to need to change their milk, feed more frequently, to change their milk or go on to hungrier baby formula. Babies feed, and they feed a lot. Their stomachs are small, they get hungry. Feeding 1 to 2 hourly, particularly in the early days, very, very normal. Particularly when around not feeling very well, particularly when around developmental growth spurts. Food is what they need to grow, and that's what happens. They feed a lot, unfortunately. Your baby is feeding 1 to 2 hourly. Is there something wrong with your milk? Do they need hungrier baby formula? My name's Ruth, I'm a health visitor in England. Let's get into it. No, there is nothing wrong with your milk. No, they do not need to go into hungrier baby formula. If your baby is gaining weight well, with plenty of wet and dirty nappies, settled between feeds, you don't need to be changing anything.
contrary to popular belief and how much society wants to make you feel otherwise, they are designed to feed frequently. They are designed to feed little and often. We're not designed to be clock watching. We're designed to be feeding responsively. Your baby shows hunger cues, maybe 30 minutes after feeding, maybe 3 hours after feeding. That's when they're hungry. That's when they're thirsty. They take from their bottle and your breast snacks, meals, thirst, comfort. Nothing wrong with that either. Lots of different needs when it comes to feeding, all of which contribute and are completely normal to feeding hourly, feeding frequently. Hungrier baby formula is not recommended, not by health professionals anyway. It's much higher in casein, which is another type of protein. Much harder to digest. Very little evidence it actually keeps them fuller for longer. All it does do is it sits in that stomach for longer. Much harder to break down, can cause wind, it can cause digestion issues, constipation, can cause an unsettled baby. It's a false economy. It's a con. You don't need it. You don't need it. Breastfeeding, feeding really, really frequently, nothing wrong with your supply, nothing wrong with how you're feeding, as long as they're gaining weight well, plenty of wet and dirty nappies. You've got this. Try to ignore the background noise, try to ignore all of these people telling you there's a problem or that you need to buy this to fix this, or hungrier baby formula will fix it. It won't. It's normal. It's hard. You've got this. You're amazing. Keep going. Your baby's 1, you want to stop bottle feeding. How do you do it? My name's Ruth, I'm a health visitor in England. Let's get into it. There's a couple of things we can do here. Now, they've either not taken very well to drinking from a cup, so I'd be introducing a cup as much as possible throughout the day. You can offer straws, you can just really try to be exposing and teaching them how to drink from things that are different to a bottle. Now, you can stop altogether. You can go cold turkey on a bottle if you would like to. There's 2 different options here of the way to do it. One is complete cold turkey. My hot water bottle's absolutely freezing. Talking about bottles. So we can go cold turkey. Now with cold turkey, we need to remember milk does still provide calories to them. And yes, beyond a year, theoretically, they should be getting their calories now from food, but some babies still are taking a lot of milk from bottles. So what we can do here is we can be making sure that we're increasing their calories of food to try to replace that milk, but also when we go cold turkey, really making sure we're offering lots of fluids as well. Now the second thing we can do is start by reducing, this is more throughout the night, but by reducing 10 mils of milk with 10 mils of water by swapping them out. Now, you mustn't do this with formula. We don't want to be changing any of the ratio of formula, but this is what we can do with cow's milk. It's also worth mentioning that when we are getting rid of the bottle, and same with breastfeeding and same with dummies and anything that has become a habit, is being kind and sensitive. They're likely going to struggle a little bit. They're likely going to miss that bottle, seek other ways of comfort, maybe tantrum a little bit more, maybe require a lot more input because, you know, it's a really nice, easy way to get comfort. So throughout the day when you're stopping feeding, really giving lots of distraction, lots of different alternatives, different drinks, foods. If you usually have a habit where you're sat on the sofa in the mornings watching telly, having a bottle, changing that habit completely for the first few days, just to try to break that association. Now, another thing worth mentioning, I've only got a minute left on here, is that if they are waking in the night to feed, this can either be down to hunger habit, which again, like we said, from the age of year, we're hoping that they're getting enough calories throughout the day. So you can do that 10 mils of water to 10 mils of milk until you're getting down to basically just water, to try to stop that association of hunger for it. But also if they need to if they are falling asleep on the bottle and that's how they fall asleep, then they're going to need that same help throughout the night when they wake up. So it's about teaching them other ways of falling asleep. We can do habit stacking when it comes to with a bottle. So introducing other habits, rocking, shushing, another comforter, and then the theory is you can then remove the bottle and you've got the other comforts. Or have a look at my sleep guides. I've got one for older babies and one for younger babies. They will teach you how to teach your baby to fall asleep independently without leaving them to cry. The reviews speak for themselves and that is in my bio. I've got 10 seconds left before it gets to 3 minutes. But yeah, please take a look at those. If you have any other questions, put them in the comments.